I think I knew when it was better, when every moment didn't seem like an eternity. I'm Emily Walvoord. I am the Associate Dean for Student Affairs, and I'm also a pediatric endocrinologist at Riley Hospital for Children. So I had very severe postpartum depression after my second child was born. My mother, who I was very close to, died mid-December, and my daughter was born in early February. And I had an almost 2-year-old at the same time, and I was a first-year faculty member. So I had a lot going on, and I think I didn't fully deal with her death because I was so busy with work, with my son, being pregnant, trying to get through Christmas, trying to support my dad and my siblings. A little bit like how we're socialized in medicine, to just keep going. When you're a physician and you have a lot going on, you can have bad things that happen to your patients, and you have to just kind of keep going. And I think that's what I was doing. I never fully processed my mother's death, and then it all came crashing down. And so after my daughter was born, I was fine for a few weeks, and then became extremely anxious, eventually stopped sleeping altogether, which is now like unimaginable how many days I went on maybe an hour or two of sleep at the most. And then it turned into a full-fledged depression after that. I had this kind of image of like crawling into like a hole in the ground and just staying there and disappearing. That's also when I started having all this shame, like, why can't I fix myself? I know there's something wrong with me, and I'm a burden. I remember specifically telling my husband, this isn't what you thought you were getting into when you married me. I'm not the person I used to be anymore. I'm so sorry. I felt like I was not a good mom, not a good partner, the whole spiral of depression by then, that I wasn't worth maybe being on this earth, but I wasn't, thank goodness, didn't get to the point of having active thoughts of suicide. Before I really got the help that I needed and got better, I kept thinking to myself, what is wrong with me? Why do I feel this way? And I just, for quite a while, thought I should just be able to mentally muscle through this, and that there was something wrong with me that I could fix myself. I have this beautiful, healthy baby. I have a wonderful husband. I have an adorable, healthy toddler. People's parents die, younger than we want them to. What's wrong with you? Fix yourself. Why can't you fix yourself? Why can't you make yourself better? In retrospect, I think a lot of that was part of my mental illness at the time, that I didn't fully recognize what was happening to me. Because I kind of look back and think, why did I just not Google postpartum depression and do I have it? But I was very dysfunctional and thought I could fix myself, or there was some magical fix. But I think I just kind of hit a point where like, I can't keep living this way. Every moment was absolutely painful to be in, and a minute seemed like it lasted 10 hours. I knew there was something very wrong with me by the time it got to that point, and that I did need help. I couldn't keep living that way for much longer. So finally, when I was so bad, I knew I couldn't keep going on and started asking for help, and getting help was quite eye-opening to me in terms of it's not a personal weakness or failing that I can't always solve my own problems. And so thankfully I had a dear colleague who got me hooked into someone. Her partner is a psychologist, got me hooked into someone in their office. I started going to actually a support group for postpartum depression that was super helpful to me. I think that medication is what helped me the most. I mean, I had a very good psychiatrist, and my husband was incredibly supportive and tried to rally friends and my sister and other people to call, reach out, help out. He was working a ton too, so that's the other problem. He's a physician as well. Once I kind of started down the path of, getting help, that helped me have hope that I could get better. I would say it was a few months for sure that I still felt horrific even after I started getting help, but it got better. I think I knew when it was better when every moment didn't seem like an eternity. Time would pass, an hour would pass, and we'd be like, oh my goodness, I didn't feel horrible that whole last hour, and I wasn't perseverating on all of these thoughts, and I feel a little bit lighter. I couldn't even listen to the radio because it brought me no joy, and that pained me that it didn't bring me joy and I didn't enjoy listening to music. Like, I knew that that was so dysfunctional for me. And so I can remember driving home from work and listening to the radio and enjoying a song, and it was kind of like this light bulb, like, oh my gosh, I enjoy listening to music again. I was so grateful that I was feeling mentally healthier. As part of my treatment, I saw a therapist for a while, and that was something she and I processed together, was my mother's death and what it meant to me. And now I am in a place where I miss her, but I feel grateful I had an amazing mom that I learned a lot from. And I wish she could be here, but I accept that she cannot be with us anymore. Medical licensing and hospital credentialing is really an incredibly important issue. When I've had to answer those questions, I can answer them honestly and say, I am fine now, but even then, when I was treated and well enough to be working and fill out those forms and answer those questions. But that's not true in every state nor in every hospital system. There are some states that ask specifically, do you have mental illness or substance abuse, for example, or history of that, for example. Those are incredibly archaic and need to go if our society is going to move forward with the best doctors and the best care. That's a huge problem. We need to keep up with the times, and otherwise, you're forcing people not to be able to practice medicine that are incredible caregivers and actually bring more to the table than someone who maybe hasn't gone through such an experience. I'm happy to share my experience if it will help someone else. I don't want people to feel like you have to have a reason to have mental health struggles. Sometimes it just happens, and there's not a bunch of inciting events. I went through something that was very traumatic for me, but I came out the other end of it, thank goodness, and I feel it actually has helped me to be a better person and a better physician. And I've realized that I shouldn't feel shame around what happened, and I try to share that with others as honestly and openly as I can if I'm given the opportunity and in the right circumstances, so that if other people are going through the same thing, they find some hope in my story and kind of normalize it for people so people will get help and see that they can come out on the other end. It's a gift to allow other people to help you.